abdominal pain, jaundice, loss of appetite. Do you know that these are symptoms of gallbladder cancer? My name is Doctor.Global. Let's discuss this disease in more detail. Gallbladder cancer. Overview. Gallbladder cancer originates in the cells of the gallbladder, a small organ located beneath the liver that stores bile. The most common type of gallbladder cancer is adenocarcinoma, which begins in the glandular cells lining the gallbladder. Gallbladder cancer is relatively rare, accounting for only 1% of all cancer cases. In the United States, approximately 12,000 new cases are diagnosed each year, and the disease causes about 4,000 deaths annually. The exact cause of gallbladder cancer is not fully understood, but several risk factors have been identified. Gallstones are the most significant risk factor, present in up to 80% of gallbladder cancer cases. Chronic inflammation caused by gallstones can lead to cellular changes and cancer. Gender. Women are at higher risk than men. Age. The risk increases with age, particularly after 65. Ethnicity. Higher rates are observed in Native American and Hispanic populations. Gallbladder polyps. Polyps larger than 1 centimeter are more likely to be cancerous. Chronic infections. Conditions like chronic typhoid infection may increase the risk. Primary sclerosing cholangitis. Inflammation and scarring of the bile duct are raising the risk of gallbladder cancer. Obesity. Being overweight increases the risk of developing gallbladder cancer by approximately 20%. Diet. High intake of carbohydrates and low intake of fiber may also increase the risk. Early gallbladder cancer often presents no symptoms. It makes it easier to grow without being detected for a long time. When symptoms appear, they may include abdominal pain, especially in the upper right part of the abdomen. Jaundice, meaning yellowing of the skin and eyes. Loss of appetite, often accompanied by significant weight loss. Lumps in the abdomen, particularly in the upper right side. What can be said about the diagnosis? There are no standard screening tests for gallbladder cancer in the general population. Diagnosis usually occurs incidentally during imaging tests for other conditions or surgeries for gallstones. Diagnostic methods are imaging tests, such as ultrasound, computed tomography, CT scans, and magnetic resonance imaging. Ultrasound has a sensitivity of about 60 to 70%, while computed tomography scans can detect gallbladder cancer with about 80% sensitivity. Endoscopic retrograde cholangiopancreatography (ERCP) allows for imaging and biopsy of the bile ducts. It has a diagnostic accuracy of approximately 90%. Percutaneous transhepatic cholangiography (PTC) involves injecting contrast dye into the bile ducts for imaging. Biopsy. Tissue samples are examined for cancer cells. This can be done during surgery or via needle biopsy. Blood tests. Elevated levels of certain substances like CA19-9 can indicate gallbladder cancer, although they are not definitive. Gallbladder cancer is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, procedures like cholecystectomy or gallbladder removal or extended cholecystectomy can cost twice as much in Mexico, Taiwan, and Egypt as in India and Bangladesh, but half as much as in the UK and UAE. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link, click Your Request at the bottom of the screen, and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. The next important part of our video is the treatment. The treatment of gallbladder cancer depends on the stage of the disease and the patient's overall health. The main treatment options include surgery, cholecystectomy, removal of the gallbladder, typically for early-stage cancer. Extended cholecystectomy includes removal of part of the liver and lymph nodes if the cancer has spread. This procedure is often used in cases where the cancer has invaded surrounding tissues. Palliative surgery is done to relieve symptoms in advanced cases, such as bypass surgery to alleviate bile duct blockage. Radiation therapy. External beam radiation therapy uses high-energy rays to kill cancer that cannot be completely removed by surgery. It is often combined with chemotherapy to enhance effectiveness. Chemotherapy. If surgery is performed and there is a chance that some gallbladder cancer cells may reappear, chemotherapy may be advised. If surgery is not an option, chemotherapy is used to control cancer growth. Targeted therapy involves drugs that target specific aspects of cancer cells, such as proteins or genes that promote cancer growth. Immunotherapy. Treatment options for advanced gallbladder cancer may include immunotherapy. Immunotherapy drugs boost the body's ability to fight cancer. And finally, prognosis and follow-up. The prognosis for gallbladder cancer significantly depends on the stage. Early-stage gallbladder cancer has a better prognosis because it can often be completely removed by surgery. Advanced stages have a poorer prognosis due to the spread of cancer beyond the gallbladder, typically to lymph nodes, liver, or surrounding peritoneal structures. Occasionally, extraperitoneal metastases may occur in the lungs and the pleura. Survival rates. The 5-year survival rate for localized gallbladder cancer is approximately 65%. This rate drops to about 28% if the cancer has spread to nearby tissues or lymph nodes, and further to about 2% if it has spread to distant parts of the body. Regular follow-up care is crucial for monitoring reoccurrence. It includes physical examinations, imaging tests, and blood tests every few months to several years, depending on the stage of cancer and treatment received. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.